Hello everyone. Now we're going to learn how to perform a treatment technique which is called the Christmas tree. This is a treatment technique which is also good for treatment of various respiratory diseases, and it can be performed 2 hours after you're finished with the clouds or lamps technique. We are using the SCENAR Sport device, but you can use any other SCENAR device model. In order to perform the Christmas tree technique, you need to switch on your device and select the treatment frequency of standard 90 Hz or 340 Hz. And then we need to apply the electrode to the patient's skin and select the subcomfortable level of treatment energy. So slightly above the comfortable level, we can also call it bearable for the patient. And then we need to find the lower boundary of the patient's rib cage. So lower boundary of the rib cage and C7 will be the boundaries for our treatment area or treatment zone. And then when we're done with this, we select the active site of treatment. We can select basing on the subjective feelings of the patient. For example, we select the side based on the more complaint, or we can start with the left side, then treat the right side, following the general pattern. Or if your scanner device allows to make any measurements of the skin parameters, you can do several measurements on both sides and select the active treatment side basing on this information. So if we select the right side, we start from the lowest rib here, and we are going from the outside to the central line of the spine. And we're doing this until we get any visible signs of the response of the human body. So we need to see some redness of the skin or whitening of the skin. This is important. And you do this only for the 2 lowest boundaries. So, as soon as we see any visible signs such as redness or whitening of the skin, we start to connect this parallel with the C7. So we slowly go upwards. Connecting this parallel to the collar zone. Now we are doing the same thing for the opposite part of the back, but we are not overlapping with the central line. We stop where the boundary of our electrode touches the line, but we do not overlap. And we do the same thing. First of all, we wait for the visual signs of the body response. And for the left side, we do not go upwards. So the right side of the back is active, treatment side. So as soon as we see any visible signs here on the left, we start to go like this, connecting each single parallel on the right with the color zone, and every single parallel on the right and on the left are going to follow each other in checkers direction, like this. So we are doing the checkers pattern. It is not necessary to wait for any skin redness or widening for the next parallels. So using the same checkers pattern, we are treating the entire back of our patient. This technique consists of two parts. So for the first part, we treat the right side of the back, and we also need to do the same thing for the left side of the back. And you can do the second part of the treatment after 12 or 24 hours. So within one day you need to perform the second, or the next day you need to perform the second part of the Christmas tree technique. So we are following the same pattern, and you need to be a little bit slower than I'm performing this technique. After we're done, we wait for 12 to 24 hours, and then we do the same thing for the other side of the back.